All right.
Welcome.
Hey, everybody. Welcome to the Wednesday Wellness Minutes with the Ellie and Chili Show.
Yep. We're back again.
And we have the camera and the mic on at the same time, so
We're off to a fantastic
we're doing
start.
great.
Yeah.
So if you've seen the caption for tonight's segment, we're talking about what does your poo say about you? Now that seems like a funny caption, funny idea, but really what we're talking about is when you look in the toilet, and you should look in the toilet, you're going to understand a little bit more about, actually a lot more about what your poo is saying about you. Okay? It's going to say a lot about your health, your detox, your gut health, hydration levels, stress levels. There's all kinds of fun stuff.
All right.
And my beautiful assistant here is going to be making poop symbols on here.
Tonight.
All right. We don't have colored markers. It's really hard to do gray and white, so we're just going to stick with a black one because, well,
It's going to be one-dimensional poop.
right, you know, you're good. So we're going to talk about different things like shape, color, smell, what else? Frequency, the time to pass and everything like that. So there's all kinds of fun stuff, whether your poo floats or not. Okay? So generally speaking, what might characterize an abnormal poop? So pooping too often, right? Some people call it diarrhea when you get loose stool, but actually pooping more than 3 times a day. I think if you look at the Merck manual or the diagnosis, I think 7 times a day is considered diarrhea. So 7 times. I know it sounds kind of crazy.
Yeah.
But if you poop more than 3, that's not necessarily bad, as long as it's a normal consistency. And some days you just need to get rid of some more stuff. But not pooping enough, pooping less than 3 times a week, I would say pooping less than 1 time a day is probably not ideal. But pooping less than 3 times a week is technically considered unhealthy. Excessive straining of the stool. I know Elvis was known to have died on the commode, and he had like it's probably like 40 or 50 pounds of impacted feces in his body because he'd taken so many, we call them doggy uppers and doggy downers, where he was taking the excitables and the antidepressants and anxieties and stuff like that because he was dealing with so many emotional issues. But that's the rumor at least. You look it up, Google it, or there's probably Wikipedia something or other on him. Let's see, greasy. If you get like little fatty droplets floating on the water, generally not considered a healthy stool. Pain when pooping. Nobody likes pain when pooping, so if that's a challenge for you, you should probably talk to somebody because that can lead to hemorrhoids and things like that, which are definitely unfavorable. Blood in your stool, definitely a sign of things. It could be a watery poop, looser, sort of liquid. Thank you. The fan just shut off. But very hard to pass stools, dry stools, and things like that. So let's talk about things that influence your stool. You can talk about foods, lack of fiber. You can talk about stress. Don't forget about food intolerances. Those are really important if you have an irritable bowel syndrome, and it can often come from food intolerances. And then you have to look back to neuro-emotional stresses related to foods because those are challenging. But stress, I mean, if you're walking around, like this, it's going to be hard to poo, right? You need to be relaxed, okay? Even though nervous system-wise, in order to fill your bladder or your bowel, you need to be in the parasympathetic stage, so that's rest, protect, and digest. So you fill your bowel and or your bladder, and or if you need to get rid of something, that's the sympathetic, which is fight and flight or flee. So understand that about your nervous system. So if you poop a lot, way too much, and it's loose, you might be stuck in fight or flight. Something might not be healthy about your bowel. If you can't go, then you might have a depressed system, per se. Something to consider. Beverages. So if you go too much, you might be getting a diuretic, which is like a caffeinated beverage. Could be green tea, black tea, your Monsters, your Red Bulls, your Mountain Dew, whatever those things are called, the green ones,
The green ones are mine.
Well, okay, anyway. Things that might affect your stool, like hydration, whether you're not getting enough water, that's really important. Bacteria and parasites can affect your stools. They can either loosen it up or harden it up or somewhere in between. And then there's some medical conditions that can affect your stools, okay? Thyroid conditions. Think about people with hypothyroid, lack of thyroid function. That's going to be constipation. That's a cardinal sign, if you will. That could be correlated with other things. There can be cancer issues. You could have issues with chemo if you're going through chemo, radiation. You could have depression as a neurological, like a neuro-emotional condition of being depressed. That can affect you. And then, of course, irritable bowel syndrome. We talked about that with foods and or other things like bugs and stuff like that. It can be affecting you. And last but not least, apparently, Parkinson's can have a role in your bowel movement. Okay? So we get to draw our first one, right? Now, who knows what a rabbit pellet looks like, right? All right, sweet. So let's draw some. Let's just do it in, there's 7 different ones, okay?
Okay.
So let's just do 1, 2, 3, 4, 5, 6, 7. Okay, just break them up into fourths. Okay? So type 1, right, are going to be small, hard pellets. Okay? There you go. Generally speaking, you won't be the happiest if your poo looked like this, but yeah, you got one sad poo in there, so it's okay. We'll work on our technique, but geez, awesome. So think of dehydration. This is a big issue with dehydration, but it can also be a spastic bowel because your bowel is like a tube. It squeezes from your mouth to your anus, right? And it moves things through. If you get little pockets of spasms, like one spasm's here, another one spasm's here, and it gets a little food particle or like a food mass bolus stuck in there, it's going to make a little ball. And then it's going to work those balls toward the end depending on how well you're moving your bowel. But think of dehydration, think about kidney stress. So think of your kidneys as a filter, but your liver is like a reservoir of water. So if you're dehydrated, I know we have certain participants that don't have a colon anymore. That's a missing link in terms of the resorption, because you're supposed to reabsorb your water and absorb your nutrients in your large bowel. And if you don't have that anymore, it's a bit of a challenge. Your body has to try and adapt to that. But your colon takes off water, pulls water back in and nutrients. Your kidneys are filtering water off. And then, of course, you have your liver, which is a reservoir. So those are 3 areas that you want to look at that might be affecting this type of stool. Yeah, I mean, think about hypothyroid. We talked about you need peristalsis, and that comes from the thyroid. So think of cellular energy, and then think back to how well hydrated are my cells.
Sure.
So if your poo looks like that, you can be assured your cells look like that. Okay. Typically less gassy when this happens, but there's no guarantee about that. You could go like a ton of gas and you got these little rabbit pellets, or you could have no gas and have the rabbit pellets. It just depends on which one you are. Okay. But that's a good indication of type 1. Now type 2 is going to be a bunch of these guys. So what is that, like a Pearson's nut roll, right?
Okay.
Give everybody some, you got some M&Ms over here, you got a Pearson's nut roll over here. Think about a bunch of these type 1s all stuck together. So kind of just draw some little blobs in there. They're all connected. Yeah. So this is a step in the right direction, right? You're not ideal yet, but you get the general idea. Yeah, a bunch of sad faces, right? A bunch of the hard pellets pushed together. So moving in the right direction, but still looking at a lot of the same issues. You're looking at stress, you're looking at dehydration, you're looking at toxicity issues that you're not detoxifying. Can be some gas with this. Just depends. Gas is normal to a certain extent because your bacteria are going to create some methane in your colon, but you don't want it to become ammonia and stuff like that from protein synthesis or actually lack of assimilation of proteins. But this is going to be a lot similar to this as far as the issues, but it's sort of trending in the right direction. At least they're sticking together now. Okay.
Right. they meet back up in the end.
Yay! All right.
Yeah.
Okay. So number three is going to be almost normal. It's like pretty much normal. Okay. So number 3 is going to be sort of this guy smoothed out. Okay. Yeah. So there's still going to be some lumpies. Yeah. There you go. Thank you, South Park and Mr. Hanky. Is it Mr. Garrison Holt? Is that okay? Sorry, had a moment there. You're getting closer. Okay. So you still got some lumpiness in here, but it's almost smooth, shall we say? Okay. So just give some contour in there, Yeah, it doesn't have to be, there you go. Okay. Generally speaking, that's going to be more normalish. Okay, so you're going to be better hydrated. You're going to have better peristalsis. It's going to be a larger mass. Like these are little tiny pellets by comparison to scale. This is probably going to be, think of this, and there's probably 3 or 4 of these coming out at one time. Then you start lumping them together, okay? So then you're starting to get closer to more of an optimal or ideal, okay? Which leads us to our optimal or ideal, which is numero 4, type 4. And we're going to give more information about like how you understand your stools and things like that. I just want to have you have a visual and you can look up what's called the Stellan stool, I think it's Stellan stool chart, Bristol stool chart. But just look in stool chart in Google Images and you'll find something similar to this with a little bit better sort of visual, but you get the general idea here. So think of this as like, I don't know, average person, depends on their bowel size, but think of this as somewhere slightly smaller than a garden hose, but definitely bigger than a pencil. If you have this shape and it's pencil-like, like really thin, that's an indication of a spastic bowel. You have a really constricted bowel, and it's just like, it's like pushing it through, but it's really constricted. Okay. So you want to, You don't want it too skinny, you don't want it too big, right? Because big means you haven't gone and you've gone too long, okay? You haven't gone, you need to go sooner. This is sort of nice garden, think of a garden hose-ish, something like that. If you're a child, maybe think of this might be an adult poo, this might be a child poo, just depends. If you're getting down to this guy, right, it's starting to get a little too thin, okay? Sweet Arsenal. Okay.
You're welcome.
She's well equipped. All right, so smooth edges, not a lot of bumpies. It's not flopping out, it's not liquidy and things like that. And I know, terrible ideas, but you get the general idea, okay? So this is gonna be more normalish, just like a garden hose. Think of a general garden hose or a marker or something like that as a general size. Now, type 5, we're starting to get into back into the gray area. So we went from 1, 2, 3. 3 is getting close. 4 is ideal, shall we say. 5 is going to get more toward the soft, fluffy blobs, shall we say. I don't know. It's kind of, how do you want to describe that?
Soft, fluffy blobs?
Right, yeah. So think of like these guys, but they're softer edges, okay? And it's going to be softer. It's not going to require much effort at all, okay? It's just going to, bloop, 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 kind of coming out of you. These you're going to have to strain at. Like these are typically, you're going to be sitting there for a while. We'll talk about transit time and length of time it should take you to poo in a second here. But these are going to be kind of relating to harder to get out. They're kind of stickier. You're going to be pushing, straining at the stool, things of that nature, okay? And here it's going to be more fluid motion. This is going to be like pretty easy, if you can get a squatty potty, if you've never used a squatty potty, they're great. They raise your feet because if you think about, the old adage is a bear poops in the wood, right? But human beings, like when we didn't have toilets, we never sat at this height and said, I think I'll poo at this height. Mm-hmm. You sit down like this, which means your feet are up and your knees are up above. So squatty potty is going to bring your knees up like this. And so what it does is it tucks your pelvis underneath and allows a more easy exit. Okay? Because if you think your pelvis, it wraps, well, like this, okay? So if you bring the bump in, it sort of more straight exit, if that makes sense. But so get a squatty potty, they're great. Costco used to have them for 2 for $25. I don't know if you can find them anymore, but I saw them one day. I'm like, holy crap, get 2 for $25? Literally, holy crap, right? Right. Sorry. All right. Anyway.
Pun intended.
Pun intended. Yeah. All right. So we got the soft, fluffy blobs. Now we're going to shift into a little bit more of now. These can, like, you can start leaning toward a detox challenges and what is called dysbiosis. You get far enough into it, you can have, like, this could technically be somewhat of a celiac issue. People get looser stools, greasy stools, things like that, malabsorption and stuff like that. That's definitely, this could be a bacterial issue as far as an imbalance there, but general idea. So type 6, you're definitely having some issues, okay? So these are going to be pretty much, think of these all like a sausage links, but they're coming out like, pretty loose, and it's not totally liquid, but it's pretty close, okay? So it's still somewhat formed, right? Maybe they're coming out, these are coming out individually, these are coming out kind of strung together, shall we say, all right? And then, so yeah, this is definitely going to be detox challenges. So if you think about your upstream from the small intestine, think about your colon connects to your small intestine connects to your stomach, but dumping into the small intestine is going to be your gallbladder and your liver. Think of your gallbladder as like a fried chicken stand, or excuse me, your liver is like a fried chicken stand, and your gallbladder is like the dumpster at the fried chicken stand. So all the garbage is passing through there, right? Do not eat fried chicken, please. It tastes great, but it's not good for you at all. And you'll actually have this down here if you keep eating that, okay? But when your liver and gallbladder dump a bunch of garbage into your small intestine, your body wants to clear it out really fast, so it's going to add water, and that's going to flush things out faster. Sure. Okay? General rule. So you might have some loss of minerals in this stage, so you're starting to flush things out because your body's trying to dump a bunch of stuff in there. That's not a good thing. You might have cramping in your muscles and things like that, but you're definitely having detox issues. It's leading to dysbiosis, and you definitely has an indication of issues. Okay? Last but not least, numero 7, number 7. That's going to be the danger zone, right? So if this is just a straight up puddle of poo, like this will probably stack up on itself in the toilet, these ones as well, but it might be floating even, but basically it's just like, I don't know, muddy water, let's call it that. It's not pretty. That is definitely an issue. That's the danger zone, because if you have uncontrollable stools that look like that, you're definitely dumping out all your important things in life. So you're losing your minerals, your liver is just toxic, dumping in your small intestine. You definitely have full-blown dysbiosis at this point.
Okay.
So you might need certain things like, up here you'd need a GI detox, GI cleanse, Opti GI cleanse. Oh, wait, hold on, that one goes down here. So this is, yep,
I'm back.
there you go. This is, so activated charcoal, zeolite clay, and things like that. That's really good for absorbing toxins. This area down here. So that's GI detox. Opti GI cleanse. This is going to move anything, no matter what. That literally. This is up in this range. When your things are stuck together, or excuse me, they're loose, pebbles stuck together, and you need to move things through, and you're just really stagnant. But you got to drink a lot of water with this. So one of the big issues we're going to get to in a minute is one of the reasons why people have these type of stools is because they're dehydrated. Okay, this is going to move things through. So we'll use this Opti GI cleanse for 1, 2, and /3.
Okay.
Okay. Remember, GI detox is for 5, 6, and 7. There you go. And then we have Cleanzyme. Yeah, Cleanzyme is also really good for 5, 6, and 7. This is a combination of enzymes, but it's also going to be a detox agent. So it's going to help your liver, but it's also going to help your small intestine, things like that. That's really great here. We'll set that kind of in the middle. And Super Aloe 250 can be cleansing. If you take too many of these, it's definitely going to give you a looser stool. In fact, usually you take one of these every other night, depending on who you are. But if you travel and you're really stressed, you don't get enough water, and you don't really get comfortable in a strange environment, Super Aloe 250 is great for it. We used to use the 450. We used to nickname it the stump blower. Right. Because it's going to dislodge anything. It's moving, right? Yeah. So that was too harsh, though, so we switched we developed our Opti GI cleanse. For general gut soothing, we use aloe. Aloe is a very delicate substance, so don't just go by any aloe. PRL, Premier Research Labs, does a great job of harvesting the aloe and preserving it at the site. They literally chop the plant and then they process it right there to give it the utmost purity and quality, I should say, because this is a delicate flower, shall we say. So you want to use this if you have this more here, and as you're coming out of this. If you need to soothe your gut, like just say you have, imagine your insides are raw. They've just been scraped and everything's just cleared out, okay? So that's going to come somewhere in the middle. That's Aloe Pro from Premier Research Labs, okay? Okay. So those are the different types, and those are the kind of different descriptions, okay? So when we talk about the different colors now normal is going to be brown, like poop should be brown. If you saw the emoji on the description, poop is brown, right? So brown is an indication of bilirubin, which comes from the breakdown of your red blood cells. Most of your poo is really the inside of your gut lining that's shutting off, and it's also the bacteria that are in your gut. So you have bilirubin from the red blood cells, you have cells from the inside of your gut lining, and you also have the bacteria from your gut. That's going to make up a brown substance. Typically speaking, you'd expect it to be brown. You start getting deviations from that, you start saying, what's going on? All right? So, one example would be green. Okay, green is typically an indication of bile. Bile is coming from your gallbladder, so if you have extra levels of bile, typically you're going to find that with a floating stool. So a greenish stool that might be floating, that's going to be excess bile. White or gray indicates an absence of bile. Okay, so white or gray, absence of bile. That means you might have a biliary obstruction, which means a gallbladder blockage. It can also mean there's no bilirubin, so you might not be breaking down your red blood cells. So keep in mind that if it doesn't have a color, it's not a great thing. Bright red, that can be if you have a hemorrhoid or maybe some type of scraping or injury on the inside of the rectum. That can be a sign. You could also have a lower GI bleed. So frank blood is like if you literally poop blood. Okay, or there's blood on your stool. Okay, because sometimes you can have really one of these hard impact. Like most likely, it's going to be these. Okay. And that can scrape the inside of your bowel, and what that can cause is some frank blood, and you can see some blood on the stool. That's definitely not a good thing. But hemorrhoids can be an issue. You got to be very careful. I mean, it's sensitive tissue in there. Okay, so be mindful. Pink. If you've ever eaten beets can freak you out because if you have a stool, you're like, whoa. Oh, that's right. I had beets the other day. Okay, no problem. You can also pee pink. If you ever peed after you have beets, they can definitely color your urine as well. That shouldn't be an issue. But frank blood, if it's bright red, that's an alarm sign. Black is the other side of so the frank blood at the end of the section and the exit, shall we say, that's one sign. That's not a good sign, but it can also be black. Now, black can be a bleed way up here. You could have a bleed in your stomach, and then by the time it gets down to your rectum and exits into the toilet, it's going to look black because it's dry blood. If you ever had you ever cut yourself or had a bloody nose and some of it dried, it looks black.
Yeah. Okay.
So keep in mind, black's not a good thing. You could eat licorice, you could have an iron supplement, too much of that. But you can have medications that cause that as well. So you got to differentially diagnosis. Do I have dried blood? Is it upper GI bleed? Am I eating licorice? Do I happen taking a medication? There's just different things, okay?
Would you feel if your stomach was bleeding?
There's very few, good question, that's a fantastic question. There's not a lot of nerve endings inside the gut.
Oh, okay.
That's why you can't feel when your gut's moving the food through.
Right.
Like you have 25 to 33 feet of small intestine.
Right.
It's like a garden hose wound up in here.
Yeah.
And then you have around 6 feet of ascending, transverse, descending sigmoid, and then rectum.
Okay.
As far as your but there's not a lot of nerves in there because
Okay.
your brain you'd be feeling that all day long. Like,
Sure.
oh, there goes my, what'd you have the other day? You guys had meatballs, Swedish meatballs,
Yeah.
Vanessa?
Yeah.
There goes my meatball. There it goes.
Right.
Right now, that wouldn't be fun, right?
Right.
Or, ooh, there's some tortilla chips. Ow,
Then what's like a stomach ache?
Stomach ache is more of a spastic issue.
Okay.
It could be like a back pressure. There could be some acidosis, some reflux going on there. So it just depends on if you're getting below the belly button, above the belly button. So immediately after you're eating, if you're getting belching or pain, that could be a
Sure.
gallbladder issue.
Okay.
If you're getting reflux, certainly that comes from the stomach. You don't want to have that. But if that's above the belly button. If you get below the belly button, then you want to start thinking things like SIBO, like gas and bloating below the belly button. That's a lot of SIBO.
Okay.
It just depends on when you're experiencing. So it's a good idea to pay attention to when you're experiencing your issues in your tissues. If it's right after eating, I know, she liked that, and that's funny.
Yeah.
Immediately after eating or a couple hours after eating, you just want to pay attention to that.
Okay.
Let's see. At any point in here, you could have like a yellowish tint to it. Now that could be, if you ever think about yellow nails, we talked about this last week. Yep. Jaundice, about this yellow skin, yellow sclera, which is in your eye, or yellow fingernails. But it can also be a yellow stool, and that could be also a fatty, could be bile, could be malabsorption, could be celiac, things like that. Celiac is a gluten intolerance, if you don't know what celiac is. That's a good thing to keep in mind. You can have orange poop. Now orange, of course, could be carrots. It could be sweet potatoes.
Okay.
But it could be some level of bile acid or somewhere in between as well.
Okay.
Generally speaking, look for brown poop. And if it's anything other than brown for even 2 days, I would say, might be something strange here. Okay, let's talk about smell. Smell, everybody loves the smell of poo, right? That smells like poo. No, I'm kidding. Nobody likes the smell of poo. But that's a natural process of bacteria in your gut. Now, if it's super, super foul, or some people say, my toots don't stink,
Right.
Like, that's normal. That might not be normal. So don't go walking around all high on your high horse because your toots don't stink, right? Even that's a joke, is
Right.
they act like their poop doesn't stink,
Yeah.
right? Well, that that means they're too cool for school.
Right.
But for you want typically some type of smell. It doesn't want to be offensive. That's typically, protein malabsorption and things like that. You're not assimilating. You could have ammonia in your gut from SIBO. There's a lot of different things that can come from that or cause that, but it should be somewhat not super stinky, but you should have an odor to it, generally speaking. Okay? All right. Floating versus non-floating. Generally speaking, you want your poop to float or to sink to the bottom, not float. Normal is not floating. Normal is sinking. Floating means either too much water in the stool or too much fat in the stool. Generally speaking, you want your poop to float to the bottom. End of story. That's pretty much it.
Right.
Okay? What else? Frequency. I particularly consider normal stools like 1 to 3 times a day. Now some people are like, well, holy crap, 3 times a day. I go 3 times a week.
Right.
Well, 3 times a week is not a good idea. Okay, that means you are not clearing your toxins. If you imagine you eat 3 meals a day, technically speaking, your oral colic or oral rectal reflex, you should be able to think about food, and your brain should start moving the food you have in your gut toward the exit.
Sure.
So it's a natural reflex that you're not in control of. It's autonomic nervous system, subconscious. So you think about food, your body starts going through, moving things through the end, okay? So you want to go 1 to 3 times a day, ideally. I would say worst case scenario would be every other day. Still don't recommend it, but definitely don't go 3 times a week. That means you're just not, you're going to reabsorb your toxins. Because your poop's a lot of toxic waste, right?
Sure.
Your liver's dumping in there, your bacteria are dumping off, and if your hormones are conjugated in there. So if you're not pooping out, it means you're going to reabsorb things because your colon resorbs things.
Right.
Okay? All right. Yeah, definitely don't do 3 times a week. Definitely average transit time. Transit time is usually between 12 and 24 hours. If you've ever eaten corn and not chewed it completely, you might know about this. Like, oh, let's see what happens. Or You get pink poop or something like that, and you're like, oh, what happened? Oh no, I ate some beets. When was that? That was oh, that was last night, or that was yesterday, or something like that. 12 to 24 hours is typically average. Okay. If you eat carrots and beets, you can check and see. Corn is another great one to check and see. But it should be easy to pass. You shouldn't sit on the commode, on the throne for 15, 20 minutes. Like somebody goes in there like, I'll be in my office, right? I'm going to go talk to a man about a horse.
Yeah.
You know, you ever heard that one? Okay.
Yeah.
That's a good one. I got a story about that one. I won't share. Might don't want to embarrass somebody. But yeah, that was a funny line from way back in the day. Anyway, had a moment there. But you should have, technically speaking, you should have an urge, go sit down and, get your squatty potty or, do whatever you got to do and then just poo within a couple minutes.
Okay.
1 to 5 minutes I'd probably say is adequate. If you're sitting there for 15 minutes and you got a bunch of sad faces coming out, or you got a bunch of sad faces clumped together and they got the squinty face and like ouchies, that's not going to be good. Okay? If you have to read a book or you're in there on your phone for 20 minutes, now if you're trying to escape somebody, that's a different story. Right. Okay? But if you're going in there, and I'd recommend you don't go in there with your phone because it's like eating. Eating and pooping should be separate from phone activities and things like that. You want to be calm, resting, centered, allow your body to cleanse out, and just be grateful to the poo gods that you're eliminating your waste. Okay? That's about it. So, how can you maintain a healthy stool? So, proper amounts of fiber. Eat your green leafy vegetables. Okay? Eat the rainbow. Bell peppers and carrots and corn and non-GMO, of course, all of it, organic when humanly possible, but eating fiber. Fiber is going to help push your poo through. Fiber is also prebiotics for the bacteria in your gut because your bacteria in your gut are helping you, remember? They're not there to hurt you. There's nothing pathological about your body. If you have a pathology in your body, it's because you don't know how to handle your stress and you have some type of unresolved conflict, as a public service announcement. Mm-hmm. But drink plenty of water. A lot of constipation happens from lack of water. A lot of feeling of lack of control. Okay, now you're probably going to go there, right?
Waiting for you.
Yeah, there you go. So colon in Chinese medicine is lack of control or a control issue. So if you're bound up and let's say you're traveling, you're bound up and you're not eliminating, that's because you probably feel out of your control, out of your comfort level and things like that. Things are stressful, generally speaking. If you have issues with the small intestine, that's lack of acceptance, but it can also be, think of the small intestine from Chinese medicine as lack of acceptance or acceptance issues, but it can also be anger and frustration. And the colon off of more of neuro-emotional stress would be more like deep down dirty issues, feeling soiled or feeling like there's something wrong with you, things like that. There's all kinds of stressors that go along with that. Rectum, if you have a really puckered exit, that's a lack of confidence, lack of certainty, lack of direction in life. Okay. So there are different stresses that go along with this. Take a probiotic if you need one. If you have this stuff going on, you might need a probiotic. You will definitely need mineral replacements, so Intramin, Optimins, we have those. That's really good for down here. What else? There's so many things we could talk about. Magnesium, as long as you don't have any kidney issues, typically magnesium helps people calm down and will help move the bowel through, but you got to be careful because there's a bowel tolerance to certain types of magnesium, so you don't want to go overdoing it. Sure. Exercise is great. If you get up in the morning, first thing and exercise, get plenty of hydration, I can almost guarantee you're going to poo in the morning, okay? I like to poo in the morning because just you start off your day and you're clean, you're ready to go, boom. Sure. Feeling healthy, feels good. But de-stress, find time for yoga, find time for meditation or prayer, whatever that is for you, but just de-stress, okay? That's really important. So any comments or additions?
Yeah, I have a question.
Please.
If someone's like intentionally detoxing, would you still want to like follow this chart?
Absolutely, yeah. Okay. Just because you're detoxing doesn't mean that your bowel should shift,
so dramatically or
dramatically down
loose.
Here. No, that's a great question.
It's too much on your body.
For sure, yeah. Okay. I mean, you need to pay attention to your body. You know your rhythm, know your style, know your bowel movements. Sure. But generally speaking, dehydrated, constipated, moving toward healthy here. Starting to get detox issues, detox and dysbiosis, and straight up, you got problems down here, danger zone. Okay. Okay. But send us your questions. Let us know your comments. Let us know if this has been helpful. Share your comments about how it could be improved. If you want clarification on anything, expansion on anything, we can comment about this in the message below. Mm-hmm. If you feel like you know somebody who sits in the bathroom for a while, either ask them why they're who they're hiding from, or what's going on with their bowels. Yeah. Or if they're just, you can't walk behind them for 30 yards on a non-windy day, right? You might want to ask them some questions, what's going on? What seems to be the issue there? But share with your friends and family if you found this beneficial. we try to present this information because no one likes to talk about poop, but generally speaking, everybody needs to know about their poop. And that's why we try to hit the harder issues, the more controversial issues, and the things that are going to benefit you the most and help you feel your best in your life and live your best life, okay? Let us know if there's any topics you want us to talk about. If you want to be a volunteer on a segment, we certainly wouldn't do it. We could do it out here, but we would do a workup and say, you know, what are your symptoms? We can trace it back to your condition, whatever it might be. We're not afraid of anything. So if you have a condition, it means you've been labeled and there you have some symptoms that fit in a box and they've told you have something. And then if you want to live down to that diagnosis, that's fine. But we recommend you ditch the diagnosis. Okay? Friday, we will be back with the live Q&A. Last couple of weeks we've been out. I was in Florida for a couple of weekends doing training for our regenerative cellular therapy. Heidi's rocking and rolling there, so we're excited. If you are interested, if you have really bad energy and you want to get some B12 shots, if you are really dehydrated and have a weak immune system, you want to do some IV, great. If you have some joints that are busted up, we can do regenerative cellular therapy in your joints. We can help you when countries open up again, go to Colombia and get systemic issues for neurological issues, Parkinson's, MS. We can do Crohn's, fragility issues, whatever. You know, there's no limit. Basically, it's the closest thing to the fountain of youth. And Ponce de Leon is kicking and screaming, excited in his grave, right? Because it's the closest thing we have.
Right.
But yeah, tune in on Friday for the live Q&A. Next week, I have not chosen a topic yet. So if you want to be modeled here and your information spelled out for you, you know, on the house, let us know. I'll be happy to work you up. But other than that, take this to heart. Pay attention to your poo. It's going to tell you a lot about your health. And let us know how we can help you out, all right? But for now, we will sign off. Melissa did not decide to join us.
I heard the door shut. Yeah.
She's gone, all right? We can see right over the temporary reception desk. So she is gone. She was like, I'm not going on camera tonight. So she's probably watching. So hi, Melly.
Hey.
All right. Have a good trip. Have fun.
Yeah.
But we'll see you on Friday for the live Q&A, and we'll go from there, all right?
Send us your questions.
Sweet. All right, guys. Have a great night.
Have
Bye-bye.
a good night.